The minister says the directive follows a spike in COVID-19 cases in the Ashanti region. Health authorities in the region fear treatment centers will be full in the coming week if measures are not put in place to control the increasing number of infections recorded in the region. A visit by City News to some areas within the Kumasi Metropolitan Assembly shows that security personnel are yet to be deployed to various areas to ensure compliance to the protocols. Although adherence to the protocols has improved, as many people were seen with their face mask properly on, some were seen without the face masks while others had them under their chins. Some residents have been speaking to City News.
If persuasion fails, force must be applied. So I believe that security will not apply any mechanism that will really go to an extent of, injure the people. If that step is taken and it will solve the whole thing, I side with it.
To deploy the tax officers to be looking up for our welfare, I think it's a good call, because some people used to take the disease for granted, and it's not good, because life is all about choices. You can either decide to die or to live, but you have to make sure that life is precious, so you don't joke with it.
People think that nothing is happening, the disease is not around. So I think if the authority enforces the law for people to comply, it will help all of us.
Meanwhile, the Ashanti Regional Health Directorate has revealed that a recent survey showed that adherence to the safety protocols, especially the wearing of the face mask, has gone up in the region.
Relatively compared to when things became intense, when we started crying out to the public, the use of face masks was below 5%. And as of last Friday, proper use, that is, people wearing it appropriately, had increased to 22% in the public, the areas that were sampled. And possession of face masks that the person has was 51% that they have. So it means that about nearly 30% had the mask, but they were not using it appropriately, either under the chin or on the forehead or just holding it. But 22% were appropriately using it. So we know that the public is hearing us.
Health experts say adherence to the safety protocols is the only way to prevent the spike. And as such, inhabitants want the enforcement done as early as possible. For City News, I am Fatih Amin Ibrahim, Kumasi.